Hi guys, my name is Dustin. I'm a respiratory therapist and a coach. A question I've been asked, can you reverse scoliosis with breathing and posture in 3 to 6 months? This is a powerful question. I'm going to give you a real honest, grounded perspective on this from my experience, my studies. So let's start. The truth. Scoliosis, a spinal curve, is a three-dimensional structural condition. So you have traditional, which is scoliosis is where you have the S shape, normal S shape is now coming forward. What you'll have is the top of your spine, the C-spine, then you have the lumbar and then the thoracic spine. It will have a natural curve to it. That's what they call an S shape. You want a natural S-shaped curve. But if it tends to be scoliosis, instead of it being an S shape, it's more of a side-to-side scoliosis. So it's side-to-side. Woo! It's not lined up anymore. It's kind of like a snake. In most cases, it's managed, not fully reversed, especially in adults. But it can be you can improve your posture, breathing, and pain and function significantly in 3 to 6 months. In some cases, especially younger patients, you may even actually change the curvature of your spine. Why breathing matters in scoliosis. So scoliosis is not just a side curve. It's not just side curve. It's your spinal rotation, rib cage distortion, and muscle imbalances. So having everything realigned together, your skeletal structure, all aligned with your muscle tissue, will help you be able to breathe in less pain and less discomfort. So what happens is one side of the rib cage becomes compressed. The other side becomes expanded. Breathing becomes asymmetrical, meaning your breath is not even on both sides. You want symmetrical, not asymmetrical. This affects lung expansion, your oxygen efficiency. You want to be able to take this nice, easy breath in, an easy breath out with a nice recoil. But if it's not efficient, that means you're not getting the quality oxygen you really need. Your posture and muscle balance is affected. Most evidence-based methods, it's called the Scoliosis approach. So the Scoliosis method is the most researched non-surgical method worldwide. What it focuses on a 3D posture correction, muscle symmetry, breathing into the collapsed lung spaces called rotational angular breathing. So you're rotating and expanding those typically collapsed areas anyway. You're placing your lung on that area, you're rotating it and expanding in that spot to stretch it further than it has before in a deep, deep, deep breath. This is deeper than 3 seconds. What the science says, studies show that moderate to significant improvement in spinal alignment and quality of life. Meta-analysis shows reduction in Cobb angle curve measurements. These are the measurements at a lower level determiner of what makes a scoliosis in your spine. They have also found improvements in posture, which is the key to scoliosis. Breathing capacity, pain. Your pain will way improve because you're not pinching those nerves anymore. Your function, your overall function will improve because your spinal alignment affects how you walk based upon your hips, and then your knees and your ankles. Very important for overall function as well. Small changes make a big improvement. I'll give you a global perspective. In India and other countries like Germany, which is the origin of scoliosis, they specialize in scoliosis clinics. In India, there's growing use of yoga-based spinal correction breathing called pranayamas, postural alignment practices. We can go over those in a different video later. In Europe and Asia, they use psychotherapeutic scoliosis-specific exercises, bracing and breathing therapy, bracing and breathing therapies. Across countries, the common thread is posture and breathing and consistency. You try to reshape what has been formed, but it's movable because your body can heal. So 3 to 6 months, realistic results with consistent work. Let's think about this. You may see improved posture, better breathing symmetry, less pain, increased lung capacity, stronger core support. Your structural curve changes. So possibly, if you're young, you might have better results sooner. As an adult, it's a little bit harder because your body's not as elastic. So at this point, you require I would include also a chiropractor while you're doing this to help you release some of these nerves. Then also increase your omega-3 fatty acids, your chlorophyll, your things that helps with your cartilage, which are the cartilage would be that one I remember, oh yeah, hydrochloric acids. Those are good to help you with your lubrication in your joints. That will help you kind of get ready to loosen up. Hot and cold therapies. We got to do that, including this therapy. In over 3 to 6 months, you might see some benefits. If anything, decreased pain and easier to breathe. So rotational breathing is breathing when it is into your collapsed lungs and the side of your rib cage. You're going to use your hand to guide expansion. So as you're going down, you go to the collapsed side, your ribs, you're going to guide it and stretch where your hand is. So you go to the opposite side, stretch where your hand is. You can do this now even if you're trying to expand your diaphragmatic breathing, which is your diaphragm is a muscle to help you breathe. Now you want to breathe down deep in your lungs, in your nose, out your nose. You're going to do slow nasal breathing. Breathe in, expand the ribs to the sideways, and then go back. You're going to do long exhalation breathing. So in deep through your nose, long out through your nose. So allow it to slowly recoil back. This helps relax the tight muscles and reduce tension patterns. It's good to make sure those muscles are not fighting you. So I'd like to have you first thing to do is make sure you're hydrated. I would take a nice warm bath to loosen the muscles. If you have to, get a nice massage. Get a chiropractic adjustment, and then try these different techniques to open you up. You have to get your body ready for this change before you just force it on yourself. So physical techniques we can do is postural awareness to begin with. I'd highly recommend using a mirror because we cannot always see what we feel. We need to see it to be able to transform what we're trying to create. So I want you to focus on aligning your head with your shoulders and then level with your hips. Your spinal elongation. You can hang from a bar if it's safe. This helps stretch your spine, allow your hips to relax, and then stretch upwards regularly. That's while sitting. You can do while standing as well. And then with the arms above the bar, helps stretch your spine. Core strength is very important. You can do side planks where you're laying with one arm and your one arm or another arm at your waist side holding you up, side plank. You can do bird dogs. They're excellent for rotating your spinal cord and flexing and contracting your hips. You can use anti-rotation exercises where you start in and you start in the opposite direction. These are rotations and up and down. And you're breathing in these, so when you turn, you're breathing into it to expand that locked airway that you want to open up. You're turning, breathe in, and breathe out. You're going to notice your hip expanding, your lungs expanding. We want to get that deep flexibility in that area. So this asymmetrical strength you can do as well. This really strengthens the weaker side of your body. So let's say this is your weak side. You're going to strengthen this side to help you work up to this one. A lot of times when we have pain on one side, it can be relieved on this one and it goes away because our body is called compensation. We are compensating creatures. We're very adaptable and we can heal. So what I like to use is a foam roller. This allows you to be able to release and open up deeper in your breath. You put a foam roller underneath your back, which is about the size of this, my hands, this is about 4 inches. You're going to put it underneath your back, nice and firm. It's going to roll down as you breathe in to different areas of your spine. And then you can use resistant bands or you're going to use Brisson bands where you're holding resistance against a non-moving surface and you're pulling against it as you breathe to expand. It's opening up your chest. My arm is stretching out straight. And then you can do the mirror technique where you're watching a mirror and you're going to open up and see your posture. You want your head aligned with your hips. I like to use a wall if I'm trying to straight up create a foundation. Now, how often I do this? I'd recommend 10 to 20 minutes. You're going to do like 5 minutes of breathing, 5 to 10 minutes of posture and strength with your breath, and then 5 minutes of stretching. The whole time you're going to do nasal breathing. And consistency is more important than intensity. This is all done in a relaxed state. So, what are people experiencing in the real world? So, this is what I've heard other people say. My back feels looser. I sleep better. I'm breathing much better. It helped me with pain, and posture requires commitment though. No magic, but the real progress with discipline is the key. Discipline's a key, and to just keep going. If you stop for a few times, restart it again. So what are some of the biggest mistakes to avoid is waiting for pain before acting. So what we need to do is start moving, start practicing before we start noticing symptoms of pain. Pain is a later along the road warning sign that things are not working. Catch it early. Do stuff now. Improve it now so that when that pain comfort comes, all right, I'm ready. I know what to do. So waiting for pain to come is kind of like waiting for the ball to drop. And once it's dropped, it's a little heavier and harder to move. But let's build your strength up to lift that ball. So I want you to know this very clearly. You're not completely helpless. You may not be able to completely reverse scoliosis, but you can stand taller. You can breathe deeper. You can move better and reduce progression of the scoliosis. And that is powerful. You have control. Your spine is not fixed in place. It's influenced daily by how you breathe, move, and hold yourself. Over the next 3 to 6 months, small daily actions can create real change. You're not stuck. You're trainable. And your lungs can help you. And when you breathe through these exercises, you actually do notice some minor changes that become great over time. It is a huge privilege to help you take control of your breathing and your posture. God bless you, and thank you.